talk about autonomic dysreflexia or autonomic hyperreflexia, depending on what book you look in. They might call it one or the other, but they're the same thing. And the autonomic part means that it has to do with the autonomic nervous system. And we all know what that is. It's the sympathetic response and the parasympathetic response, right? Sympathetic, fight or flight; parasympathetic, rest and digest. So what happens is some kind of noxious stimuli will kick off the sympathetic response, right? The sympathetic response, anytime you get noxious stimuli, anytime you get some kind of a stressor, your sympathetics kick in, and that's just your fight or flight mechanism. And if you look over here, some of the responses here to the autonomic nervous system, ANS, right, is the sympathetic nervous system. Sympathetic nervous system, you get vasoconstriction, you get sweating, you get an increase in your heart rate, bronchodilation, right? Just some real common reactions when your sympathetics kick in. Your parasympathetic is the rest and digest, and that one there you get vasodilation, a decrease in heart rate, and a bronchoconstriction. So what you have to remember is these two systems, it's not like one or none. They're both working all the time, and one takes over the tone, kind of in a tug of war, just to try to maintain homeostasis, right, so that you can stay balanced. One without the other would be too overwhelming for the system, and that's kind of what happens here. So again, you get some kind of a noxious stimuli. Noxious stimuli stimulates the sympathetic nervous system to kick in, right? So the adrenergics take over, right? You start getting more adrenaline, so you start getting a higher sympathetic response, and that's what is supposed to happen. Except in this case, you're not getting the parasympathetic response. Like I said, they're kind of in a tug of war, right? The two of them are, one pulling this way, one's pulling that way. Well, you've got this sympathetic response, but you don't have the parasympathetic response because the parasympathetic response has to come down the spine. The sympathetics, on the other hand, are a reflex, right? Bear comes, boom. I don't have time to stop and think about, I wonder if this is a dangerous situation. I think it probably is, so I'm going to run, right? That's not how it happens. Bear comes through, growls, boom. Right? Hairs stand up on your head, boom, you're out of there. Boom, you just take off. Right? There's no decision there, you just do it. And that's the way it should be, because that's how you stay alive. So, what happens? Well, you're going to have to run away from the bear, right? What happens? You get these symptoms over here, right? So in this case here, the noxious stimuli causes what would normally be a pretty toned down version of the sympathetics kicking in, but they're unopposed. The parasympathetics can't get down there because parasympathetics aren't the reflex activity like this. It doesn't just go to the spine and back. Parasympathetics come down from the upper spine, right down from here on the lower brain, and it comes down and it does all of these things, right? That's where its action comes from. Well, you've got the sympathetics responding. Now, I've drawn a picture here. You've got the sympathetics, right? Let's say the person has distended bladder or bowel or something, a bowel impaction, or somebody stomped on his toe or something, some kind of noxious stimuli down here below this level. You get this sympathetic activity, right? Boom, boom, boom. So these things happen. Vasoconstriction, sweating, increase in heart rate, bronchodilation, right? You get all that. But the main thing to think about here is you're getting vasoconstriction, right? It's raising up your blood pressure, right? Increased heart rate, blood pressure is going up because of whatever noxious stimuli is here. And there is no opposing parasympathetics here. So your pressure goes up, it goes up pretty quick. You got really high blood pressure, and the receptors that you have, chemical receptors that you have, like in the aortic arch and the carotid artery, those things feel the stretch in those arteries. They say, hey, wait a minute, pressure is getting too high here. We need to lower it. So they stimulate the parasympathetics to kick in, right? We need more parasympathetic activity to try to counteract this sympathetic activity because pressure is too high. That's what happens. That's one of our regulatory mechanisms for blood pressure. So sympathetics kick in, pressure goes through the roof, The baroreceptors sense the stretch in the arteries, and boom, it stimulates the parasympathetics. Now the parasympathetics are up here. So they kick out right? They go out there and you get vasodilation for your parasympathetic response. They can get to the heart, right? It doesn't come down the spine here, it comes out right here and goes down to the heart. So it can get to the heart and slow the heart down. So now pressure had gone up in response to the noxious stimuli via the sympathetics. The high pressure was detected, and now the parasympathetics are trying to lower it. So they can only cause vasodilation up here above the level of injury, which is usually T6 or above. So now what are you going to get? You're going to get vasodilation up here, but unfortunately you can't get it down here. So there's not enough body up here to vasodilate to counteract all the vasoconstricting going on here, so pressure stays up really high. Dilation gets more and more. So you end up with dilated vessels in your brain and huge blood pressure. So you got a really high blood pressure, dilation in your brain, dilated vessels in your brain, bad combination, right? So you're going to worry about a stroke, and this person has got the most throbbing, horrible headache in the world. I mean, these people would be crying, except for most of them can't cry because it just hurts so damn much they can't cry. If this has happened, they will present with a horrible headache. And if the paramedics are bringing them in, they will usually have them on a backboard, flat. First thing you want to do is sit them up, right? They should be sitting up 90 degrees, all the way up. Feet should be down, right? Get as much of that blood down in their feet and away from their brain as you can, right? So there's the first thing that you want to do. And now when you think about it, the injury needs to be fairly high. It should be T6 and above is where you will usually get this problem. If it's below that, you can probably get enough vasodilation from the parasympathetics that it can offset and bring the pressure down a little bit. So if you're a paraplegic and you're only affected in your legs, it's unlikely you'll get this, because this parasympathetic response will get the arms, the whole torso, your front and back, and your head and stuff. So it can offset that. You might get a little more hypertensive than usual when something noxious down there happens, but it doesn't lead to this autonomic dysreflexia. Your T6 and above can lead to this. So what's this person going to look like when they present? Well, they're going to have a horrible headache, right? They're going to be complaining of a headache. Their blood pressure is going to be through the roof, right? Because they're going to have a high blood pressure and a terrible headache. Flushed upper, right? Face will be flushed, and arms, depending on the level. And the lower part, the legs and stuff, will be cool and pale, right? So they're going to be a contrast there. Bradycardia, right? Because the parasympathetic response is slowing that heart rate down, because it's trying to decrease your blood pressure. So the parasympathetics is saying, slow down the heart rate. Let's get this pressure down. Unfortunately, it's not really working, right? Slowing the heart rate down doesn't work as much as you would think, because the heart usually will fill up even more and pump out more with each beat. Now it can drop your blood pressure, but not enough to counteract this sympathetic response in 3/4 of the body. Another thing, they might have a stuffy nose. They probably will have a stuffy nose, right? Because in the head part, you've got the parasympathetic response, which is acetylcholine, right? So it's a cholinergic response, and cholinergic makes everything wet, right? So you'll probably increase the discharge and your nasal discharge and all that stuff. So, and if you remember right, anticholinergics will dry that stuff up because it's anticholinergics. Well, here you're having a cholinergic effect. So, yeah, common sense, right? You put it all together, it's common sense. So now let's go through what we're going to do for this. Like I was saying, head up, feet down, if at all possible. That's what you want to do. Assess their blood pressure. Put them on a blood pressure monitor if you got one. Set that sucker for at least 5 minutes, right? You don't want any more than 5 minutes is how I should have said that, right? So maybe you want to check it every minute, every 2 minutes, but don't go longer than 5 minutes. You want to be really watching that blood pressure. So this guy comes in, he's got a bad headache, you set him up, you checked his blood pressure, it's really high, you know what's going on. The next thing that you want to do right now is look for the reason. Feel that bladder, Number one cause, bladder distension. If it's distended, easy fix. Lidocaine jelly on a catheter and straight cath that guy and get that urine out of there, and all this stuff will fix itself. You'll decrease that sympathetic response because you've gotten rid of the noxious stimuli. You might have to roll them over, check for a bowel impaction. Same thing, you're going to have to use lidocaine jelly to numb that area if you have to dig something out there, or if you're going to put an enema in or a suppository. Now let's say you can't find the noxious stimuli, or let's say it's skin breakdown. You can't do a lot about it right now, right? You can try to numb it, but you might have a hard time, or for some reason, whatever reason, you're not able to get that pressure down. You're going to have to go to medicines, right? IV in, nitro drip, or a nitro paste. Nitro paste, you can put on a little, goes on these little piece of paper that comes with it, and you put 1 inch or 2 inches or a half an inch, whatever is appropriate, and you put it on there and then you tape it on, right? And of course you always date and put the date and time and probably your initials on it so that the people will know when that nitro paste was applied. Another thing is how much, like 1 inch at such and such a time on such and such a day, and then your initials. If they don't go with nitro, they might go with nifedipine. It's a little capsule. You can put a little a hole in the end and squirt it under the tongue. Now that's something that we used to do all the time when people came in with hypertension. It was really dangerously high. They quit doing that and started using more gentle medicines because there's a rebound hypertension after you do that. Like an hour or so later, boom, it comes up really fast. Although this works fast, it brings it down fast. But I was surprised in the book, and this was, actually wasn't a book, it was an article, a journal article I was reading, but I was surprised. It actually recommended that you use that. Because this is, and the reason I was surprised, because like I said, it's something we used to use a long time ago, but we quit using it because of the rebound hypertension. But in this case, I think they're thinking, let's get that pressure down, then take a look at this person and see if we can find out where the hell this noxious stimuli is, or what is causing this response, so that you can hopefully do that and get this to come down. And you might also give this person anti-anxiety. Believe this person is very anxious, and the anti-anxiety might just slow that down, because anxiety just causes this continual loop there with the sympathetics. You'll see this in people who are in hyperventilation mode and they just can't stop, right? They just keep breathing real fast because they can't break that anxiety is causing that loop. If you're going to send this person home, you got to make sure that you teach them the right things. One thing is, these people should always be hydrated. The culprit might have been that this guy was out at a fair or something all day and wasn't drinking well and stuff, and that's enough. Your sympathetics will start to kick in, right? They'll start to kick in and say, hey, wait a minute, I'm getting dehydrated, I'm not feeling good, boom, it'll start kicking in. For most of us, the parasympathetics will off-balance that, and we might know that I'm not feeling real good, I want to go sit down and rest in the shade or something, but get something to drink or whatever. But this person here doesn't have that balance. So when he's out there and he does something that causes that, boom, he can go into this response. Another thing is caffeine. Avoid caffeine, because caffeine can trigger this. Tell them, always measure the urine. Make sure that they're getting a decent output. Make sure that they keep their bladder empty. If these people are self-cathing, don't go skipping it because it's inconvenient. They can't feel it, doesn't feel bad, but no, every 2 hours, boom, empty that bladder. And you want to make sure that you're putting out like 30 cc's an hour. Same thing, bowel regimen. Make sure that they can maintain a bowel regimen. Keep track of their bowel movements. Know that they are putting out stool. So they might need stool softeners. Be very quick to use them if you need them. High bulk diet. Right? They're going to need things with a lot of the roughage on it so that they can maintain that bowel movement. And skin care. Make sure that they take good care of their skin. If they have a caregiver, their caregiver has to look their skin over head to toe all the time. Make sure that they're repositioning so they don't end up with bed sores. Keep their skin moist, like lotion with some kind of a barrier. If they're incontinent, make sure they get cleaned up right away, right? They have to take good care of their skin, so actually good hygiene is important. Right, so I think I've pretty much talked about everything here. So just remember, right, you get the Parasympathetic response above the site of injury, the sympathetic response below the site of injury, and if the injury is high enough, that sympathetic response is going to set off a hypertension that the parasympathetic response can't fix. And vasodilation and high blood pressure vasodilation in the brain and high blood pressure is a bad combination. I think that's it.